Good morning. Thank you very much for this opportunity to address this concern that we all have. And good morning to Minister Jacobson, Dr. Mollad, Dr. Matheson, distinguished delegates, ladies and gentlemen. It is a privilege to be here to address this forum. Today, I would like to address a topic that is fundamental to all our people: health and mental well-being in the Arctic. Our history with modern-day healthcare is interesting. It hasn't always been a seamless connection between modern health and holistic approaches practiced by Inuit. In Nunavut, we are continuously looking at ways for modern healthcare and Inuit practice to be better integrated. We know that physical, psychological, and social aspects are uniquely connected. Our health indicators show we still have a lot of work to do in moving our people forward and providing the supports to make healthy choices and live healthier lives. We are taking steps in this direction in many fronts, especially with the ending of the cycle of suicide. This is an unfortunate issue and a harsh reality that many of us in Nunavut have experienced in some way or another. Our territory has seen an increase in suicide in the last 3 decades. The rates of suicide are 10 times the Canadian national average. But we also know that suicide has not always been an issue historically, and we are doing everything possible to address the current crisis. We are moving forward with new determination to make suicide a thing of our past. In October last year, our Premier, Peter Taptuna, declared suicide a crisis in Nunavut. We created the new portfolio of minister responsible for suicide prevention, of which I lead. Our government created a new quality of life secretariat to oversee the implementation of our suicide prevention strategy. That strategy was introduced in 2010 and followed 2 years of community and stakeholder consultations. We have trained more than 2,000 people to be interveners. We have child and youth outreach workers, mental health workers, and psychiatric nurses in many of our Nunavut communities. We now have 2 mental health facilities. In March of this year, we added another 22 positions across the territory, bringing our budget to a total of $24 million. We are seeing a higher proportion of Nunavut Mute report a strong sense of belonging to their local community. This key strength is fundamental to our public health efforts. It fits with the Inuit definition of health, which relies on the psychological, physical, and social well-being of individuals in a system of strong communities. We must also recognize that the prevention of suicide does not solely lay with the government or a department. It requires partnership, collaborative initiatives, and involvement of all our stakeholders, communities, and individuals to see real change. We are reflecting those principles in our work with our partners, Nunavut Tungavik Incorporated, led by their president, Kathy Tautungi, the Royal Canadian Mountain Police, and the Embrace Life Council. A 1-year action plan called Resiliency Within has been created. The action plan guides us to this fiscal year. while we continue to engage stakeholders in developing a longer-term plan. We are employing Inuktitut counseling by way of a mobile trauma response team and via a toll-free telephone line. This service, provided in partnership with Ilisak Civic, a community-based wellness center, utilizes their counselors trained in Western and Inuit healing skills and knowledge. We hosted recently a stakeholder summit on suicide prevention, which is integral to seeing our long-term action plan. The summit opened the conversation about more good work taking place in our communities. The Akvet Wellness Center introduced a Young Hunters program after school, which looks at food security, mental wellness, transmission of traditional knowledge, and intergenerational connectedness. It received positive interest from our youth. In Hall Beach, another example, a men's group was started to help men stay out of jail cells with regular counseling and healing with elders. Men and their relationships with their families are improving and healing. These examples demonstrate the strength of the individual and community initiatives that serve the core for mental wellness, resiliency, and suicide prevention. They also serve as a reminder that the most effective programs and initiatives are locally initiated, culturally appropriate, and are based on Inuit societal values and tradition. We believe community members know what their communities need. The hardest work is being done now by our elders, informing counselors, informal counselors, mentors, and leaders. They are the ones who lead language and cultural camps, Inuktitut preschool activities for youth and parenting programs. Above all, with the summit and other initiatives, we are reaching out to those people who are in the justice system, who are facing abuse or dropped out of school. We are listening. Nunavut want intergenerational healing circles, men's groups, and youth groups in their communities. Our way forward is based on cooperation, collaboration, and rooted in the knowledge that Inuit health is holistic in approach. Without doubt, we are faced with a challenge, but also an opportunity to remind ourselves and others of the resilience of the people of the Arctic and the strength of others, and the strength of Arctic solutions based on the cooperation between Arctic regions and its people. Our future requires collective action. We are all in this together. Thank you. Ataw salmik inu salmik inu katigita.